Welcome to the overview of the Affordable Care Act. Today we'll be explaining the Affordable Care Act, including the Employer Shared Responsibility provision. We will cover the impact of the state of California as well as your department, as it will require changes to how you process employee health benefits, and you will see how these changes are necessary to help the state avoid costly penalties. So what is the Affordable Care Act? The ACA is the federal health care law that ensures all Americans have access to quality and affordable health care. The law was voted on by lawmakers, then enacted in March of 2010. Its provisions will take effect from 2010 through 2020. This includes several employer provisions that impact the state of California. Two provisions have already impacted the state: the reporting on the cost of employer-sponsored health coverage on W-2 forms and the employer notice about the health insurance marketplace coverage options requirements. Beginning January 1, 2015, the Employer Shared Responsibility provision will take effect, which will require the state to offer health coverage to at least 95% of full-time employees and their dependent children to avoid penalty assessment. All state departments and entities are considered one employer for ACA purposes. So when we assess whether the state meets the 95% threshold, we must consider all state employees. But how does the ACA define full-time? Actually, the ACA defines full-time by an employee's hours of service. If an employee averages 130 hours or more per month, they are considered full-time. Hours of service include hours in which an employee is paid or entitled to payment for hours worked, and paid leave, which includes vacation, holiday, illness, disability, jury duty, and military duty. Based on this definition, how the state currently appoints employees by tenure and time base is irrelevant for ACA purposes. As you can see, the ACA definition is based strictly on hours of service. So what about the provisions regarding affordability? The ACA stipulates that health coverage offered by employers must meet the law's affordability and minimum value standards. Coverage is deemed affordable if the employee's contribution for self-only coverage for the lowest cost plan available to the employee that provides minimum value does not exceed 9.5% of the employee's monthly salary or the employee's wages for the calendar year or the annual federal poverty level. Coverage is deemed to provide minimum value if the plan covers 60% of the total allowed cost of benefits provided under the plan. The good news is that the health coverage offered by the state already meets these standards for 2015. Additional provisions will take effect over the next few years. More information will be available as they are released. Are there any repercussions if we don't comply with the ACA? What will happen to the state? That's right, penalties. There are two types of penalties: Employer Shared Responsibility Penalties A and B. Let's take a look at each one. Remember when we mentioned that the state must offer coverage to at least 95% of its full-time employees and their dependent children? If the state does not meet that threshold, it may be subject to penalty A. This is known as a no coverage penalty. How does it work? Currently, the state has approximately 225,000 full-time employees. If the state fails to offer health coverage to at least 95% of them, we may be subject to a $2,000 annual penalty for each full-time employee. That's 225,000 full-time employees multiplied by $2,000 for a total of $450 million. Let me say that again. $450 million. The penalty applies to all full-time employees, not just the ones who weren't offered health coverage. Now let's look at penalty B, known as the inadequate coverage penalty. Even if the state offers health coverage to at least 95% of its full-time employees, it may be subject to a $3,000 annual penalty for each full-time employee that receives a premium tax credit for purchasing individual coverage through Covered California. To demonstrate compliance with the ACA and to avoid penalties, the state must file annual reports with the IRS beginning January of 2016. These reports will list each full-time employee and include information about health coverage that was offered to them and their dependent children. Currently, the state only captures whether or not an employee is enrolled in health coverage, not whether an offer of coverage was made. In response to this, a new online tool is being developed by SCO to capture the data the state will need to report to the IRS. You will be required to use the online tool to document when an offer of coverage was made based on an employee's eligibility. So be on the lookout for this. Seems like a lot of work to stay in compliance. Thankfully, 3 agencies share responsibility for this. CalHR is responsible for carrying out statewide ACA implementation activities. CalPERS is responsible for ensuring that its health plans and regulations meet the requirements of ACA. SCO is responsible for reporting to the IRS on the state's full-time employees. They will also contact departments to validate the data captured in the online tool. So you may be wondering, what does this mean for you, and when does it take effect? Effective January 1st, 2015, the state and your department will be relying on you to follow the new business processes and procedures to ensure that necessary employee data and the offer of health coverage is captured in SCO's new online tool. With your help, your department will be able to monitor these business practices to ensure compliance to reduce the state's risk of penalties. As you can see, your role is critical in ensuring the state complies with the provisions of ACA to avoid the penalties discussed earlier. Now, more good news. The state is not changing how health benefits are offered to employees or how eligibility is currently determined. You are not responsible for determining if the state's health plans meet the law's affordability and minimum value standards. That's CalHR and CalPERS' job. Woo! And finally, the SCO online tool was designed to be easy to use. Yes, training for the online reporting tool will start in October of 2014. In addition, training will be available on an ongoing basis and will become a regular part of the SCO statewide training curriculum. To accommodate schedules, training will be made available online. Our intent is to reach as many users in the most convenient manner possible. We look forward to your participation in these training opportunities. This completes the overview of the ACA program, its provisions, the impact to the state of California, and your role in the implementation and ongoing compliance of the program. As we move forward, we will share updates with you through multiple forums. Thank you for your participation.